Hi, my name is Dr. Halbeth. How are we doing today?
Good, how are you?
Great. So what we're going to be doing is I'm going to assess your spine from approximately the portion of your the upper neck to your lower back. If at any moment I need to expose the skin, will that be okay?
Mm-hmm.
And can I palpate you for the remainder of this exam?
Yes.
Okay, I'm going to check the table real fast. Alright, so first what we're going to do is a general scan. I'm just going to be assessing your spine and your range of motion. So if I can have you sit right here and face the window, please. Alright, and may I open your gown?
Yes.
Alright, so what I'm going to be doing is I'm going to go to the top of your iliac crest. I'm going to windshield wiper down to the PSISs. I'm going to be springing posteriorly to anteriorly and medially to laterally. On your SI joints, looking for range of motion. Now I'm going to oscillate up your spine. I'm going to check your cervicals. Can I touch your forehead? Mm-hmm. Alright. I'm going to be pressing superior to inferiorly at first, and then moving inferiorly to superiorly as I move up the cervicals. Alright, and your motion was good. I'm going to close you back up. Okay, next what I'm going to do is I'm going to assess your SI joints, your right SI joint. So if I can have you lay down, face down right here, please. Okay, I'm going to open you back up. Alright, can I tuck your britches? Alright, so what I'm going to do is I'm going to go to the top of your iliac crest, windshield wiper down to your PSIS. I'm going to stick my fingers in the joint space between your ilium and your sacrum, and with my other hand I'm going to just slightly lift up on your ASIS. I'm lifting up in an anterior to posterior manner and laterally to medially. What I should feel is your ilium going inferiorly, medially, and posteriorly, which I do, meaning you have good range of motion and joint play. Now I'm going, and this was for flexion of your joint. Now I'm going to assess extension. So once again, I'm going to go to the top of the iliac crest, windshield wiper down to the PSIS, and I'm going to put my fingers once again in this joint space between the ilium and the sacrum. And on the contralateral side, I'm going to lightly flex up the ASIS. And what I should feel here for extension is the sacrum moving posteriorly over the ilium, which I do, meaning there's good range of motion, and I'm pulling up in an anterior to posteriorly, lateral to medial manner. Alright, so that is extension. You have good joint play. Okay, now what I'm going to do is I'm going to assess your L2, L3 segment. So if I can have you sit up once again and face the window. Alright, may I open your gown?
Yes.
Okay, so what I'm going to do is I'm going to bisect the iliac crest. I'm going to go medially, which would put me at a level of L4. Since I'm going to the L2, L3 segment, I'm going to go 2 spinous processes, L3, L2. Now I'm going to go into the interspinous space between L2 and L3. What now I'm going to check for is flexion of this joint. So I want to see the L2, L3 joint open up. If I can have you cross your arms, please. As I'm flexing here, I feel the joints opening up, indicating a healthy joint and joint play present. Now what I'm going to do is I'm going to assess rotation. So I'm going to move to the lateral aspect of the L2, L3 segment with my finger on the L2 contact. I'm going to rotate her to the left. What I should be feeling is opening up the 2 joints, which I do feel, indicating joint play is present. To assess end play, I'm going to pull her to tension and spring laterally to medially. I should feel resilience, which I do, indicating end play is present. Now I'm going to go to the other side. I'm going to assess right rotation, so I'll be on the lateral aspect of the L2, L3 segment. Can I have you cross your arms, please? I'm going to rotate her to the right. Once again, I should feel the joints opening up, which I do, indicating joint play is present. To assess end play, I'm going to pull her to tension, spring laterally to medially. What I should feel is movement and resilience in the joint, which I feel indicating end play is present. Now what I'm going to do is I'm going to assess lateral bending. So once again, I'm on the lateral aspect of the L2, L3 segment with my finger on the L2 contact point. And have her cross her arms. I'm going to laterally bend her to the right. Once again, I should feel the opening up of these joint spaces, which I do, indicating joint play is present. To assess end play, I'm going to pull her to tension. I'm going to push 1/8 of an inch laterally to medially, looking for give and recoil, which I do, indicating end play. Once again now, on the left side, testing for lateral bending. You cross your arms. I'm on the lateral aspect of the L2, L3 segment. Contact on the L2. I'm bending her to the left, assessing for joint play, which I feel because the joints are opening. To assess end play, I'm going to further pull her, springing laterally to medially 1/8 of an inch, looking for give and recoil, indicating end play is present. Whew. Out of breath. Now what I'm going to do is I'm going to assess the T8, T9 segment. So if I can have you pull your arms behind you, please. I'm going to go to the inferior border of the scapula, bisect to the middle, where I'll be on T7. From there, I'm going to go down T7, T8, and what I want to do is I want to be right in the middle of the T8, T9 segment in that interspinous space. I'm going to again assess her flexion. So I'm going to have you cross your arms. What I want is I want to feel these two joint spaces opening up, which I do feel, indicating that joint play is present. Now what I want to do is I want to move out to the lateral aspect of the T8, T9 segment. I'm going to assess rotation, so I'm going to have you cross your arms. I'm going to rotate her to the left. I should feel these joint spaces opening up, indicating joint play is present, which I do feel. In order to assess end play, I'm going to pull her to tension, spring laterally immediately 1/8 of an inch, looking for the give and recoil, which I do feel, indicating end play is present. Now I'm going to do the same thing for the right. Lateral aspect of the T8, T9 segment. Cross your arms. Rotate her to the right. I'm looking for those joint spaces to open up, which I do feel, indicating joint play is present. I'm going to pull her slightly to tension, spring laterally to medially, looking for the give and recoil, which I do feel, indicating end play is present. Now once again, on the lateral aspect of the T8, T9 segment, I'm going to assess lateral bending. So, with my contact on the T8, I'm going to laterally bend her to the right. I'm looking for the joint spaces to open up between the T8 and T9, which I do feel indicating that joint play is present. To assess end play, I'm going to pull her to tension, spring 1/8 of an inch laterally and medially, looking for resilience, which I do feel indicating a healthy joint. Now I'm going to assess lateral bending on the left side. You cross your arms. I'm on the lateral aspect of the T8, T9 segment, contact on the T8. I'm laterally bending her to the left, looking for the joint to open, which it does, indicating joint play. Now what I'm going to do is assess end play. I'm going to pull her further to tension, spring laterally to medially, and what I'm looking for is the give and recoil, indicating a healthy joint, which I do feel, which means end play is present. Lastly, what I'm going to do is I'm going to assess her ribs for T8, the T8, T9 segment. So if I can have you pull your arms back. I'm looking for the inferior border of her scapula, which will put me at T7. I'm going to go down to T8. I'm going to go up 2 interspinous spaces, so 1, 2. I'm going to first assess her right rib, so I'm going to go 1 inch laterally to the transverse process, and another inch to the rib, which will be the 8th rib. So now what I'm going to do is I'm going to assess elevation. So I'm going to be on the inferior border of this 8th rib. I'm going to have you cross your arms. I'm going to flex her, contralaterally rotate, and contralaterally bend. I'm going to be pressing inferior to superior and slightly posterior to anterior. This is assess joint play. In order to assess end play, I'm going to be pushing her inferior to superior and slightly posterior to anterior. This is end play. Which I feel the ribs elevating on one another. And now what I'm going to do is I'm going to assess depression of this joint. So I'm going to be on the superior border of this rib, have her cross her arms, and I'm going to extend her, ipsilaterally rotate, ipsilaterally bend. What I should feel is the joint closing on each other, which I do feel. In order to assess, and this is to assess depression and joint play, in order to assess end play, I'm going to push superior to inferior and slightly posterior to anteriorly. I feel resilience, indicating end play is present in a healthy rib. Now I'm going to go to the other side, so let me have you pull your arms back, please. Inferior border of the scapula, T7, T8, 2 interspinous spaces up, out an inch laterally to the transverse process, and another inch to the rib. What I'm going to do is I'm going to assess elevation of your left rib. Have you cross your arms, please? So what I'm going to do, I'm going to flex you, contralaterally rotate, and contralaterally bend. I'm going to be on the inferior border of this rib. I should feel these joints opening up, which I do, indicating joint play is present. And that was elevation. To assess depression, I'm going to be on the superior border of this rib. And then to assess end play for elevation, I'm going to be pushing inferior to superiorly and posterior to anteriorly, and end play is present. To assess depression, I'm going to be on the superior border of this rib, and I'm going to extend, ipsilaterally rotate, ipsilaterally bend. So I'm going to go right here, and I should feel the rib closing on each other, which I do feel, indicating joint play is present. To assess end play, I'm going to be pushing superior to inferiorly and slightly posterior to anteriorly. And the joint spaces do close on each other, indicating end play is present. Okay, close you back up. That is it.